Hey, it's Dr. Presley here, and some other things you need to think about prior to your total joint arthroplasty are some medications you need to stop or maybe start prior to your total joint arthroplasty. So the biggest thing we talk about is blood thinners. So I always ask if my patients are on blood thinners because a blood thinner like Xarelto or Eliquis needs to be stopped 3 days prior to surgery. Antiplatelets like Plavix need to be stopped 5 days prior to surgery, and Coumadin also needs to be stopped 5 days prior to surgery. Now, if you're just on a baby aspirin once a day, that's okay to continue. If you're just on anti-inflammatory medication like ibuprofen as needed, you can continue that. But if you're on a full strength aspirin, that needs to be stopped 7 days prior to surgery. And also, those blood thinners can be important. You might not be able to stop them, so you need to talk to your hematologist to see if you need to be bridged with a different medication prior to surgery. Some other medications you need to look into are diabetes or weight loss medications like the injectable GLP-1 medications. Those can delay gastric emptying, so we want you to stop that about a week prior to surgery to prevent any kind of aspiration or coughing up food during the surgery. Other things to think about are if you have rheumatoid arthritis, there's some medications you need to stop, so make sure you mention those to your doctor and see if you need to stop those. Some things to maybe start are a lot of people are deficient in vitamin D, and vitamin D is very important. So I like my patients to take vitamin D, or at least we check their vitamin D level and see if it's abnormal, and usually it is. So usually we have them take vitamin D. And some other supplementation is mainly just diet. You want to be on a healthy diet. You want to make sure you're getting enough fiber to help keep everything moving, especially when you're on narcotics or pain medications after surgery. They can cause constipation. And you also want to make sure you have a high protein diet because protein is very important in healing. So that's some things to look into prior to your surgery to get ready for a good outcome after total joint arthroplasty. We'll talk later.